Thank you so much for staying with us. Let's now take you live to our city center studios, where we'll be speaking to the Secretary General, Kenya National Union of Nurses, Bwana Seth Panyako. Good afternoon, sir. Thank you so much for joining us today.
Good afternoon.
Thank you. So, sir, if we could just go straight on to the issue of personal protective equipment, because the first two stories that we ran, sir, were of clinical officers saying that they do not have sufficient PPEs. We also saw the Kenya Progressive Nurses Association saying that they will tell their nurses to work from home. Do we have enough PPEs?
The reality is that there are no personal protective equipment, especially from level 4 all down to level 1, the level 2 hospitals. You see an example of Ngara Hospital, where we have 59 health workers sent home to quarantine. It shows clearly that health centers and dispensaries and the level 3 have been neglected by the government. So when the government says that they are prepared for this pandemic in the country, and yet we have the bulk of the health workers not being prepared. Most people who work at dispensaries and health centers are not trained. Unlike those who work in level 4, 5, and 6, are trained, because we have, in any health facility that has got a theater, definitely the theater staff are able to train other health workers on how to don the protective gear and how to doff them off. But dispensaries and health centers are neglected, and actually we do not have enough personal protective gear in all our health facilities, apart from maybe Kenyatta and Bakathi and maybe Moi Teaching and Referral Hospital.
But then again, sir, for how long shall we sing this song? Because again, yesterday, the same thing we are saying today, my colleague Ibrahim Karanja spoke to one of the officials of the KMPDU branch in Nyeri, and she was saying the same thing. She spoke about having few ICU beds, having few protective gear. For how long shall we sing this song, sir? And what needs to be done? I mean, this pandemic, it's already here with us, 59 cases as of now, sir.
The reality is that the government must take extraordinary measures to meet the requirements of the personal protective equipment, because we know there is shortage even in the developed countries. America has the problems, China has the problems, and other countries. So what is required is that the government must move with speed and implement local production of protective equipment. I have seen Kimathi University has started manufacturing those locally protective equipment. I have seen in Kitui, the Charatingilu was already producing personal protective equipment, and I'm told that Rivertex in Eldoret is about to begin production of personal protective equipment. So I believe that if these three institutions begin to produce this personal protective equipment, then we shall be left with other dynamic issues that must be addressed to make sure that health workers feel protected and feel actually appreciated for the work that they are doing, sacrificing to work when they know that everybody else has been told to work from home, while the health workers and security forces in this country are still working. So we believe there are many other issues that frontline health workers ought to be addressed for us to feel appreciated and for us to feel protected by the government.
Let's look at some numbers here. I want you to tell me what you think about them, because I remember the last time the president issued the executive order, he had said that by 15th of March, we should have, isolation wards across the country, if I'm not wrong. Now, there was this sitting by the Council of Governors Health Committee, and I understand from my colleague Brian Obuya that they say we have only 22 counties. 22 counties rather do not have ICU facilities. They want the national government to help the 22 county governments to set up ICU facilities, and that all the 47 counties have challenges in PPEs. Your thoughts on that, sir?
The reality is that if we can experience 25% of what is happening in Italy today, we can have the entire population in this country wiped out. Because even superpower countries are not able to manufacture enough ventilators. And this is a challenge that we cannot say our country is not able to do it, because even if they want to purchase the ventilators, we are being told there are no ventilators outside there. I have been in studio with one of the local studio in Kenya, and Mohamed Kuti, who is the chairman of Health Committee for Council of Governors, has indicated that the government is trying to negotiate with General Motors so that they can start producing ventilators. So we understand this is an issue that maybe cannot be resolved. The only issue to resolve it is for Kenya to try now see the reality of having companies to produce our own locally produced, not only equipment, but even machinery, even ventilators. That's the only way to go. If we are not going to produce our own ventilators, I can assure you there are no ventilators in the world that can be bought even if you have money. These are times where you can have the money and that money cannot help you. So we understand that challenge and that dynamic. But in terms of isolation rooms and isolation areas that has been isolated by the government, I have a feeling that it is adequate, because we have all secondary schools free, we have all Kenya medical training colleges free, we have universities. The only problem we have is, do we have adequate staffing? If we have 25% of the pandemic that is happening in Italy or France or even China, the answer is we do not have enough health workers. The ones we have are already stretched. They are underpaid. They are not appreciated. They are not even having life medical insurance. Some of them are earning very little money. We have now the issue of transport, where transport has been doubled, because now one is forced to use 2 seats. It means you have to pay double. We have the issue of the health workers who are now infecting their colleagues, like the issue of Ngara, where clinical officers went and infected her husband and the children have been infected. I have been saying all along that let us identify frontline health workers, mark them and quarantine them, so that every 14 days they are also tested to see whether they have the virus or not. We are also saying that we need these health workers frontline to have life insurance. In case one of them dies, what happens to the family that's being left behind? So we are saying as health workers, and especially the nurses, that we want a health risk allowance of Kenya shillings 20,000 and one doubling of the commute allowance. So the government has every responsibility to ensure that there is equity within health sector. There is no way you will say nurses are happy when their colleagues who are in third line of defense are earning 20,000 risk allowance, while the nurses on the front line, first line of defense, are actually earning 3,850. So we want equity. We cannot be appreciated when you clearly see that the government is favoring particular group of workers against others, while the frontline health workers are not protected and are not appreciated.
And lastly, before I let you go, please, in under a minute, on Monday we saw the ministry through the Director General, that is Dr. Patrick Amoth, projecting, 1,000 cases by the first week of April, and April is here, 10,000 cases by end of April. Are we ready? If we get to that, God forbid, are we ready? Lastly, sir, in under a minute, please.
I have already told you that if that really happens in this country, we are going to have a catastrophe that we cannot manage, because already the little that we have, we are not able to manage. If we reach 10,000, it means in every village there will be somebody infected. And yet dispensaries and health centers where villagers go for treatment, health workers at that level are not protected. It means we'll have a community where health workers are infected, the community is infected, no one is going to take care of anybody. So the government must move with speed. In fact, the government is not involving stakeholders in the decision they are making and the approach they are taking. We have been told they are supposed to hire other 1,000 health workers. We have not seen any advertisement being made. We want the government, first of all, to confirm health workers who are working on some dubious contracts across the country, return those health workers that have been stopped from working through a procedural method on duty before we start thinking about how we can revamp our healthcare system. We want health workers to be appreciated and we want them to be really supported. We don't want support to come from the mouth. We want practical support. We want them to be financially supported. We want them to be supported by protective equipment, and we want them to support it wherever they are, right from a dispensary all the way to level 6, level 7 hospitals.
Indeed, sir. Thank you so much for joining us.
But we are not prepared. We are not prepared to handle 10,000 infections.
Okay, sir. Thank you. Thank you. Seth Panyako there, the Secretary General, Kenya National Union of Nurses, speaking to us on whether we are ready. And in his words, he says, we are not. A lot still needs to be done. We're projecting a figure of 10,000 positive cases by the end of April. But he says we are not ready. Okay, let's cross over to the world of sport.